They say they've come to instill a sense of urgency about the situation in Gaza that has reached breaking point, where shortages of food, water, fuel and medical supplies have exacerbated the trauma of civilians caught up in this war.
I saw the most appalling atrocities, and I saw things that I never would have expected to have seen in any healthcare setting. I'm going to talk about what I express the need, the real urgent need for a ceasefire to prevent ongoing humanitarian catastrophe. And I want to just dispel some of the narratives which we hear about coming from the Israelis, but also from some of the media as well, about the targeted bombing, the fact that they claim they're only targeting Hamas militants and that they are protecting civilians. And I can certainly bear witness, as my colleagues can, and as indeed any medic who's been on the ground in Gaza in recent months can dispel that notion with absolute certainty.
Professor Maynard is an Oxford-based cancer surgeon who has also worked in Gaza for the past 15 years.
I spent some time a while ago looking up the definition of genocide in a variety of dictionaries, and what is going on in Gaza fulfills every single definition of genocide that I have read. So there's no doubt in my mind that's what's going on, and I think the end game, it appears to those of us who've been on the ground there, and indeed more importantly is the views of all the Gazans I've spoken to, is that the end game of the Israeli government is to force them out completely from Gaza, to eradicate them from that land.
He also explained that there were mass indiscriminate bombings in Gaza, killing thousands of civilians, and what he called a very clear targeting of healthcare facilities and healthcare workers, the deliberate destruction of medical infrastructure that he argues makes it almost impossible to provide anything resembling normal healthcare to the population. The conflict has already claimed around 32,000 lives, the vast majority women and children, while almost 75,000 have suffered injuries, often catastrophic, while an estimated 7,000 persons remain missing, thought to be trapped under mounds of rubble. This US-based medical practitioner says Gaza is unlivable today.
Gaza is reaching a tipping point where the shortage of food and water and fuel and medicine and medical supplies, and also the collapse of the healthcare system, is causing accelerated deaths among people who are innocent, and also people who are injured and having surgeries, having more complications. And that is leading to what we are right now witnessing in terms of the famine, increasing rate of malnutrition, food insecurity that is rising, catastrophic in half of the population, and more deaths related to non-communicable diseases because of the shortage of medicine and dialysis and chemotherapy for cancer patients. So these numbers will continue to accelerate even if the war stopped right now.
They complained that they witnessed hundreds of trucks stalled at the Egyptian Rafah border crossing with Gaza, with much needed medical supplies that could impact the situation on the ground.
We want to get as many people involved in this as possible.
This doctor is a Chicago-based emergency medicine physician who spent 3 weeks volunteering at the Al Nasser Hospital in Khan Yunis.
We know that these trucks have baby formula. We know that they have many items. And I just wanted to show what some of those items may look like. Diapers. Inhalers for those with asthma.
Yeah.
And this small vial of medicine here is a medicine that we use for sedation, midazolam, Versed. This is something that we could be using for our patients who are there, who are in pain, we're trying to reset their fractures, we're trying to clean their burns. It's an incredibly painful process, and this is something that can help. Something this small, we're not able to get into the Gaza Strip because the trucks are stalled. Or if someone is having difficulty breathing, as you may suspect may happen as bombs are dropping and the air fills with smoke, not able to get a rescue inhaler in to be able to treat their asthma.
And while there's a huge focus on surgeries, other areas of care have also been left vulnerable.
We have a system where the hospitals rely on quota systems for how many drugs they keep in their pharmacies and their stocks in each department, and they have to choose between whether do I fully stock my operating theater, my ICU, or my emergency room.
The doctors also warned that were there to be a ground military offensive in Rafah, where 1.5 million displaced Palestinians were sheltering, it would be apocalyptic. Sherwin Bryce, SABC News, New York.